Imagine you're in a classroom with 26 students, all chatting quietly with each other. The teacher is speaking and everyone is listening and responding in an orderly way. This is like normal brain function, where different parts of the brain are communicating with each other in a coordinated and controlled manner. Now imagine someone starts yelling loudly, and suddenly everyone in the class starts shouting at the same time. The noise becomes chaotic and overwhelming. This is like what happens during a seizure, where the brain's electrical signals become too strong and synchronized, causing a disruption in normal brain function. Seizures essentially take place when multiple nerves in the brain region experience excitation, which is essentially when they fire electrical impulses when they're not supposed to. A seizure occurs when there's a temporary change in the way that the brain sends electrical signals. Therefore, when a seizure happens, there is a short circuit in the way that messages are sent between brain cells. Every brain has the potential to have a seizure. Just like how the classroom can be disrupted in many ways, seizures can manifest in different ways too. Some people might experience a mild confusion, like a student who suddenly lost their train of thought. Others might experience a full-blown convulsion, like a student who's having a loud, uncontrollable outburst. Think of the brain as a city with different neighborhoods, each with its own unique functions. In a seizure, the electrical signals can affect one or more of these neighborhoods, leading to different symptoms. For example, if the seizure affects the part of the brain that controls movement, the person might experience convulsions or loss of coordination. Just like how the classroom can be restored into order with the teacher's help, treatment and recovery from a seizure can involve medication, therapy, and lifestyle changes. The goal is to help the brain's electrical signals return to a normal, coordinated state, allowing the person to function normally again. So, how do you know when someone is having a seizure? There are a variety of seizures that will be further covered in this video series, namely generalized onset, focal onset, and unknown onset seizures. These terms refer to which area of the brain a seizure affects. However, some key symptoms across all of them include short-lived confusion, a staring spell, jerking movements of the arm and legs that can't be stopped, loss of consciousness/awareness, changes in thinking and emotions. While there are many symptoms of seizures, it is important to know what to do when an individual begins to show symptoms such as the ones mentioned. According to the NHS, if someone is having a seizure or fit, there are a few simple things you can do to help, starting with remaining calm. First, make sure to only move someone in a seizure if they're in immediate danger. If the individual is on the ground, use a piece of soft clothing or garments to cushion their head. Make sure to loosen any tight clothing, such as collars or ties around their neck to ease breathing. After convulsions and sudden movements stop, turn the person on their side into the recovery position. Stay with them and communicate calmly until they recover fully. Lastly, note the time for when the seizure starts and when it ends. One of the greatest causes for injuries during seizures is unnecessary intervention. It is important that the individual can be in a certain position safely until the convulsions stop. However, there are certain times when you should call for an ambulance according to the NHS. If it's the first time someone has had a seizure, make sure to call the ambulance. Number 2. If the seizure lasts more than 5 minutes and you are unaware of how long the individual's seizures have typically lasted in the past. Number 3. If the person doesn't gain full consciousness or has multiple seizures without regaining consciousness. Or number 4. If the person is seriously injured during the seizure or the person has difficulty breathing after the seizure. If you observe any of the symptoms mentioned, make sure to remember to dial the emergency number 998 for ambulance in the UAE. This video is part of a larger series on epilepsy awareness, a campaign which aims to inform individuals in our community about everything from what to do during a seizure to the differences between every seizure.